Hi, sir. Happy to see you here.
Thank
First
you.
of all, welcome to Times Network India Health Summit 2026. That is absolutely South Edition.
Thank you.
So, we are so happy that you're part of the event today. So, how do you feel?
I feel privileged to be here today, and I'm very happy to receive this award from Governor and been selected as excellence in robotic joint replacements, which I have been passionate about since young age.
So, today we are with Dr. Vikram, who's a robotic knee replacement specialist, right, sir? So, I just wanted to ask you one question as we are celebrating today the South most advanced and the privilege what we had, like all the people choosing South India for the treatments. So, what is your opinion on that? Like, why people are choosing South Indian hospitals more?
Okay, first, that's a very nice question. First and foremost is that affordability is the issue. So I think we are giving an affordable care here.
Yeah.
Because most of the corporate systems or the hospitals have taken that into the consideration, keeping affordability as a main criteria why patients are not getting the surgeries done.
Yeah.
And the other one was the fear. So probably, if I'm not wrong, we have very good healthcare systems here, and our hospital equipments or the standards are far near to the international standards. That could be one reason why people from all over the world, if I'm not wrong, have been coming to Hyderabad especially and getting the surgeries done.
Okay. So, Dr. Vikram, I have a few questions for you. So, yes, I would be happy to know from you.
Please
so, like, Doctor, what exactly made robotic knee replacement become the gold standard compared with conventional knee replacement?
Yeah, so now if you see, we have to be par with the advances which are coming to us. So now the robotics have become a gold standard, because if you see any corporate system or any corporate hospital, why corporate, even small hospitals have a robotic systems now?
Yeah.
To give very good, precise and aligned joints.
Obviously.
So now if you don't be competitive with this robotic systems or using AI, we are nowhere. So, and that we are using this advanced tool to give a better pain-free life to the patients.
Okay.
So that is very important.
Definitely, yeah. So the next is like, what percentage of recovery depends on the surgery, and also what percentage depends on rehabilitation and patient participation?
Yeah, so that is very important. I have to explain this to the patients also.
Definitely, sir.
Because surgery is only half done without proper physiotherapy and patient's mindset.
Obviously.
Because surgery is always a 50%, and the 50% depends on patient's mindset, how she wants or her or him to be recovered, and how they are doing the physiotherapy.
Yeah.
Post-op physiotherapy is very, very important for the first 2 weeks. If they are very they're very positive, patients are very positive, and they want to get back to their normal routine and lead a pain-free life. So these patients need to be motivated, self-motivated, and do proper exercises what physiotherapy tells, and that is a key for good pain-free life.
Definitely, that has to be followed.
Yes.
But many people miss that in many cases.
Yeah, but now most of the educated people, they know, they understand that, because they have to go work, or they have to work is very important. If they sit at home and they stop working, their livelihood is affected.
Yes.
So they are well educated, but in rural areas, they get surgery done here and they go and they go back to their homes.
Yes, obviously.
Which is far more than 200-300 kilometers from Hyderabad. And they don't have proper physiotherapists or someone, so they don't do proper physio. So I made it a point that all my surgery patients, they stay here for a week, get trained by the physiotherapist, are motivated and given a positive feedback, and their mind is set before leaving the hospital.
And they practice the same in their hometown too.
We give you the videos also.
Obviously. So you are known for minimally invasive subvastus robotic knee replacement, which definitely you have to explain it to us. And why is preserving muscle so important for recovery?
Yeah, very nice question. So I do more of joint replacements, especially the knee, and in that I do a minimal invasive and I do spare the quadriceps muscle. The quadriceps muscle is the engine for knee extension.
Oh,
Whenever we
yeah.
have to do a knee extension, the quadriceps muscle is very important.
Okay.
So when we do cut the muscle for joint replacement, I have seen over the time that patients tend to recover little late. So what I did is I've spared the quadriceps muscle, which is called as subvastatus. Many of the doctors do, surgeons do, but I use minimal invasive. I do a small incision so that the blood loss is less, the pain, post-operative pain is less, and patients tend to walk by evening.
Okay.
I operate in the morning, they tend to walk by evening. So that confidence, if I give to the patient, they are much more happier and they feel that this is a very small surgery and we can do whatever we want within 2 weeks.
Yeah, I just want to ask a very common question among people. There's a myth, like what we can say is, if you once do a surgery for your knee, they'll say that in later days you can't even go walk properly. Like it is never a good decision to make in life, because we'll hear this from many of the people coming from villages or someone. They'll say like, no, you can't sit down at all, you can't be as normal as earlier, so don't go for that. Like, can you just tell us, like, is it the same way?
No, it is a myth. So, but see, if a patient is coming for a surgery, they're already in stage 4 of arthritis. That means it's in the final stage where the knees are completely worn out, the thigh bone and the leg bone is already touching, and they're not able to walk properly. And these people, they've been walking like that for at least a year and a half. So they've already forgot how their normal life is. They lead this painful life for almost a year and a half, and they come to us. And this is because they're either scared of the surgery or they're not affordable. These are the two things which keep them away from the surgery. So when they come to me, I made it a point that I try to explain them how affordability can make surgery easier, and also what are their fears. And I tend to show a few of the examples of the patients who have been operated before by me.
Yeah.
So I show them and how they came, in which condition they came, how much bend, and how it has improved within 5 or 6 days. They start walking without support. So when I show those videos, I tend to ease their fears. So once that is there, they have that positive mindset. And coming to the affordability, when we do a robotic we usually is expensive. Obviously. Because we get these instruments from abroad.
Yeah.
Yet we don't have much better or sophisticated robotics here in India, which might come in the near future.
Okay.
So when we import, these are very costly. So that burden is already there on the patient when we operate, because that we have to get back, the corporate hospitals. Okay. So what I tell the patient, if I operate a robotic knee, you're not looking for 1 year or 2 years. If you're looking for 1 year or 2 years, the cost of the surgery is always high. But if I operate now, the surgery is going to last for 20 years. Okay. One surgery is going to last for 20 years. Yeah. So when I tell that, if you calculate for the 20 years, you're just hardly paying in thousands per year. It is just like getting an insurance. So when I try to explain that, most of the patients convinced, but few still they don't get convinced.
Definitely.
So over the time, maybe that will help.
Yes. This is like very important question which I thought of asking. Like, arthritis is what is a very common issue like that we can find around us. Like, I know many people who are suffering from arthritis, but I also know that they are very clear that they don't want to get operated, because in a myth that, I don't know if it's a myth or not, like arthritis will not be cured if you're done with a knee replacement. You can walk, but after 6 months or something, again it is going to attack. So is that
No, that is completely false, and it's not right. The thing is, if you're getting it done by a proper surgeon with proper evaluation, I guarantee myself, I've done thousands of surgeries. The main priority is we operate in the morning, we make patient walk by evening. They are in the hospital for 2 or 3 days. Okay. They're trained how to use, what exercise they have to do, how to use a washroom, and what food they have to take if they're diabetic or hypertensive or any other surgery. Okay. And I've created in such a way that everything is protocol wise. If patient comes with this problem with arthritis, and arthritis is never a disease. Primary arthritis is just an age related problem. Like you're just getting white hair when you get older.
Oh, yeah.
So as you get white hair, it is also wear and tear in the joint. So it is never a disease. But yes, secondary arthritis is there where it is in disease form, like rheumatoid arthritis, gouty arthritis, psoriatic arthritis, where there is inflammation which is causing arthritis. So these patients tend to take medicines for longer duration even after the surgery. But primary arthritis, which is age related, is not a disease. It's just a age related wear and tear.
Okay, I think this helps a lot of people. This is a very great information
Yes.
actually. So, are there situations where a conventional knee replacement may still be appropriate?
Yes, I still do conventional replacement, and yes, I would like to tell my colleagues or my younger fellows who are coming into the orthopedic field. So if you are trained only in robotic, you will get stuck in the surgery some or the other day. So you should always learn how to do a conventional surgery to bail out when there is a problem with the robotic, because robotic is just an advanced tool which helps in giving a better outcome, but it is not going to operate itself. So it is always a doctor's judgment which helps in giving better outcome. So I do revision knee replacements where the joint already operated a patient whose implant has failed for whatsoever reason. Either it's been old 15 years, 16 years and the implant has become loose, or patient had a fall and had a fracture. So in such conditions, we cannot use robotic always. So I tend to use my judgment, interop real-time judgment, and then give a better outcome.
That's definitely.
So it is not always that you have to rely on robotics.
Definitely. So how much percentage of people believe in robotic knee replacement?
Now, see, when we started around 8 years back. It was hardly 20% of the patients. The first question they were asking is, so you have been doing non-robotics before. Now, what is that you're going to gain with the robotic? You're just going to charge extra for us. But now it has come to 80-20, where 80% of people are coming to us and asking for robotic knee replacements or hip replacements. So probably because of the Insta or the social media or the results which we are giving, so that has inculcated in their mind. The patients themselves are coming and asking for robotic knee replacements or hip replacements.
That's definitely a great growth, I guess.
Yes.
We have the future in front coming up. So, what is that one thing a robot cannot do that only an experienced surgeon can do?
See, it is the experience of the surgeon. It is a judgment. I mean, if you're stuck in between a surgery where the robot is not working or it becomes dysfunctional, so if you don't know how to operate, you cannot rely completely on a robotic.
Obviously.
So you have to bail out. So that can only happen with the surgeon who has been well trained for almost 15-20 years in this practice. So that is one thing which a robot cannot do.
Definitely.
Robot doesn't have an emotion, or it doesn't have think. It cannot think.
Yeah.
It can only give an accuracy or alignment whichever we ask. So it only takes the data and gives us the result. But if you don't have a proper judgment, then that is going to be a failure.
Definitely. That's really great talking to you, Dr. Vikram.
Thank you.
Thank you so much
Nice
for being
meeting you.
here today.
Thanks.
Thank you.